Our next speaker is Ms. Pam Belluck. Ms. Belluck is a New York Times staff writer whose many honors include a Pulitzer Prize and a Victor Cohn Prize for Excellence in Medical Science Reporting. Her work has been chosen for the Best American Science Writing. Her book, Island Practice, is about an eccentric doctor and is currently in development for a TV series. Ms. Belluck has covered various subjects, including long COVID, reproductive health, brain science, and neurological disorders. She is frequently invited to speak about her work and has taught at Princeton and has served on advisory boards related to science communications. Ms. Belluck will present on how long COVID is affecting people's jobs and their needs at work. Ms. Belluck, the floor is yours.
Thank you so much. I really am honored to be here presenting to you all, and especially joining this incredibly esteemed group of other speakers. And thank you, Dr. Kavanaugh, for inviting me and also for advancing the slides. I appreciate that. So I've been covering long COVID for more than 3 years now. And in the course of that work, I have talked with many patients, researchers, health providers, family members, and others. And one of the most compelling things I've learned is the profound way that this complex condition has affected people's ability to carry out the lives they led before they were infected with the coronavirus. Symptoms like brain fog, fatigue, memory impairment, post-exertional malaise, tremors, muscle weakness, other whole range of symptoms have had a significant impact, including on people who were previously healthy and were previously thriving at their full-time jobs. Long COVID has caused some of them to stop working altogether. It has forced others to reduce their hours or to downshift into less demanding jobs. It has required many to seek workplace accommodations or adopt coping strategies or make fundamental changes in their schedules and activities. And I'll be giving you some examples of that from patients that I have spoken with and written about, and also talking about some data. This first slide shows Bridget Hayward, who was an operating room nurse. And she told me that for a while after, when she was struggling with long COVID, she was so brain fogged that instead of asking for a scalpel, she would say, "Give me that sharp thing we cut with." She would also briefly pass out while bending down to fix a patient's intravenous line or plug in the cord of a hospital bed. I also spoke with nurses who would forget what the patients told them when they left the exam room and would have to go back to check what medications to order and what tests to order. This is Summer Khan. When I spoke with her a couple years ago, she was only 25. She was trying to handle her job in financial services while grappling with symptoms like blurred vision, ringing in her ears, trembling fingers, and brain fog so intense that she would have to stop in the middle of a conversation with her husband because she couldn't remember what she was trying to say. She told me, this is a quote from her, "Waking up every day in this body, sometimes hope feels a little dangerous. I have to wonder, am I going to recover, or am I going to just figure out how to live with my new brain?" This is Michael Reagan. He had to take a leave from his job as a vascular specialist for a company that makes stents and catheters because he had finger tremors, seizures, and in meetings he couldn't find the words that he wanted to say. Again, all these folks were healthy beforehand. He also had significant memory loss issues, and just one example that was just a particularly vivid example from his life. Just before the pandemic, he and his husband took a trip to Paris, and he told me that he would look through all the pictures and say, you know, looks like we had a great time. We went to a Madonna concert. We went to the Eiffel Tower. We went to the catacombs. And I remember nothing at all. And this is Erica Taylor, who was in her early 30s. She thought when she got COVID in the summer of 2020 that she'd need only a brief break from her work as a lawyer for an Atlanta nonprofit helping low-income tenants. But she had episodes in which she said, everything in my brain turned to white static. And she told me that one morning, she said, I was sitting on the edge of the bed crying and feeling something's wrong. I should be asking for help, but I couldn't remember who or what I should be asking. I forgot who I was and where I was. I'm giving these illustrations because these were people who were in very high functioning jobs. They were not only healthy, and most of them were quite young, but they were not slackers by any means. And for them to be so powerfully affected tells you something. After a couple months, Erica resumed working, but then she found she couldn't concentrate. She couldn't read emails. She ended up having to take an extended leave. And last year, this is about nearly 2 years after her COVID infection, she and I were invited to be on a panel at a conference, and she was still experiencing challenges. And in the next slide, there's a little bit of video from her, how she was describing her current situation, which was last April.
It was 6 months that I was out on disability. And my boss had actually called right when I got on these pills. And he said, listen, we held this job open as long as we could for you, but we have to get somebody else in. And I told him, well, I just got on these pills and I think I'll be able to work a full day with these stimulants. He said, okay, well, we'll give it 2 weeks, see if it, works, then you can come back. And that's how I was able to come back. I've been back now for about a year, but literally every day is a struggle still. And like I said, the cognitive impairments, they've gotten just kind of better with time, but I still use so many tricks to get through the day. I have everything written out in lists, and processing is slower for me. It's still all in there. I remember the first day that I went back to work, I was so afraid I wouldn't know law anymore. And it was actually, we were in a debrief meeting where they were talking about cases. And I asked a question. I was like, okay, if I remember correctly, this is the law for this, right? And the relief I felt when he was like, yeah, that's exactly the law. I was like, okay, good. I still know law. But like I said, processing is slower. I use 1,001 tricks to get through the day. And it's still one of the hardest things I've ever done. I'm just doing it every day. And that's where I'm at right now.
So there are not that many studies yet about the workplace impact, but there are some now that are starting to document this landscape. This one comes from a study led by Dr. Roy Perlis, who's the director of the Center for Quantitative Health at Mass General Hospital. And he, along with colleagues at Harvard, Rutgers, Northeastern University, and Northwestern University, launched the COVID States Project, and they've been tracking some of this data. They analyzed data from 8 waves of an internet survey of adults from all 50 states that was conducted between February 2021 and July 2022. And out of about 15,000 respondents, nearly 15%, or about 2,200 adults, had long COVID. And their most common symptoms were fatigue and brain fog. And this slide, it's hard to see all the granular data, but basically what they found was people with long COVID were about 15% less likely to be working full-time than people infected by the virus who didn't develop long COVID. They found that 46% of long COVID patients were working full-time compared to 55% of those without long COVID. Again, these were people who were infected, so they did all have COVID, but the people without long COVID were much more likely to be back at work. About 12% of people with long COVID were unemployed compared to 9% of those who didn't develop long COVID. They did adjust this data for differences in race, ethnicity, and geographic region. And they documented that for many people with long COVID, this was a big change from their employment status before the pandemic. The data on the far right, you can see that people with long COVID were more likely to be employed prior to the pandemic than people without long COVID, not less likely. So again, these are folks who are used to having full-time jobs, and it's a huge change for them after they develop long COVID. And people who had cognitive symptoms like brain fog and memory impairment were even worse off. They were 25% less likely to be working full-time. This summer, the Urban Institute published the results of another study, a nationally representative survey of more than 7,800 adults between the ages of 18 and 64. This survey was conducted at one time point in December of 2022. They found that of the 4,300 or so adults that had ever been infected with the coronavirus, about 18%, close to 800 people, had long COVID at the time of the survey. next slide shows some data from that, found that 10% of adults with long COVID reported that they had stopped working for a period because of their symptoms. And at the time in December 2022, half of them were still not working at the time of the survey. In addition, 24% reported that to be able to continue working, they limited activities outside of work, like social activities, errands, chores, and about 3% changed employers to accommodate their long COVID, and about 2% requested a change at their current employer, such as a reasonable accommodation or a change in job. And the next slide, this is also Erica giving, she wasn't part of this particular survey, but her experience, I think, gives you a very vivid idea of how she's been affected by this and how she's been interacting with her employer as well.
Where I stopped telling people that I had COVID brain fog because they didn't take it seriously enough. And instead I told them I had brain damage because I needed them to understand how serious it was. And I even, said to people, I was like, I need you to understand I am disabled now. I am disabled. And I recently had performance review with my boss. It did not go well because I process things slower. It takes me longer to keep up with things, and I get 100 plus emails on a given day, so it's very hard for me to keep up with. It was always hard for me to keep up with, even when I had a full brain. I caught up with it by working every morning. Was the first person in, last person to leave. Worked on them at night, worked on them on the weekends. That's how I caught up. And I told my boss, listen, we are at a nonprofit especially, we are in this environment where we internalize and we take it for granted that we are willing to go above and beyond because we care about our clients and we care about these issues. But I was, and honestly am still doing the exceptional, and you're treating it as normal. And so now when I can't work as much as I did because I have chronic fatigue and I have to rest, and I just have a smaller energy envelope and less brain capacity, you're still rating me by that before I need a better measuring stick. I'm pouring from a shallower cup. And his response to me was, well, all nonprofits are like that. And I was like, okay, that's a deeply unsatisfying answer. And so, but I'm not giving up, I'm waiting for my chance to be able to talk to HR about it. Because honestly, I believe that if I can just get someone to hear, they'll understand, like, this is a disability and you need to work with me to help me figure out how to do this. But it is serious, and my brain's probably not ever going to be the way it was before. So I think those are the most important things to realize. This is serious. You have to work with us. You have to give us grace, and never take COVID lightly. Because even if you have a mild case, it could get serious after that.
More data from the Urban Institute report found that overall, people with long COVID were twice as likely to be out of the labor force for health or disability reasons than those who were infected with COVID but didn't develop long COVID. And that survey also looked at some other socioeconomic consequences. 42% of adults with long COVID reported food insecurity, which was more than double the rate of people who had been infected but didn't develop long COVID. 20% of adults with long COVID had difficulty paying their rent or mortgage, and 23% had trouble paying utility bills, with 9% experiencing a utility shutoff. And of course, all of this is connected to the employment picture. Another snapshot of data comes from the New York State Insurance Fund, which is a workers' compensation fund, one of the 10 largest workers' comp insurers in the country. And they received, of the more than 3,000 COVID-related claims that they received during the first 2 years of the pandemic, nearly a third, almost 1,000, involved long COVID. And the long COVID claims cost the fund about $17 million out of the approximately $20 million that they paid to all COVID patients. So long COVID was much more expensive. Basically, their definition was to qualify, you had to have a positive test, and the agency or a workers' comp board had to determine that you had a high risk of being exposed to the virus while at work. So typically in environments like hospitals or grocery stores or transit systems. So this is a select population, but it gives you a snapshot. And they classified a case as long COVID if the patient required medical treatment for 60 days or more, or lost 60 days or more of work. So they found that about 71% of people who were classified as experiencing long COVID required either continuing medical treatment or were unable to work for 6 months or more. More than a year after contracting the coronavirus, 18% of long COVID patients had still not returned to work, and more than 3/4 of those folks were younger than age 60. The most common long COVID symptoms that people put in for workers' comp for were shortness of breath, fatigue, weakness, and cognitive and memory problems. 40% of claimants with long COVID returned to work within 60 days of becoming infected while still receiving medical treatment. And the authors of the report considered that important because they said that if you're going back to work, you're still needing medical care, the chances are that you might need some workplace accommodations as well, like reduced hours. And there was some interesting information about the types of workers who filed these claims. So most of the COVID-related claims were filed by essential workers, people in occupations like healthcare and law enforcement. But only 29% of the claims of essential workers were for long COVID, whereas 44% of the claims filed by non-essential workers were for long COVID. And the report said that doesn't mean essential workers were less likely to develop long COVID. In fact, because they had a very high rate of exposure to the virus, they may be more likely to have long COVID, but they may have been less able to stay home from work or file workers' comp claims. So it just sort of tells you there are some things we don't know. Now, this report also found some optimistic signals. Since the pandemic's first wave in early 2020, long COVID cases decreased as a percentage of workers' comp claims and of COVID-related claims. And that decrease coincides, as we heard from our previous presenter, with the availability of vaccines and also antiviral treatments. So that supports the idea that if you can avoid becoming severely ill from the initial infection, you're less likely to experience these long-term symptoms. We don't have a good estimate, really a good number of how many people overall are unable to work because of long COVID. And there's one estimate by Katie Bach, who's a fellow at the Brookings Institution, that it's about 500,000 people. But a lot more studies on this are necessary. And this could change over time. Hopefully, it will change in a positive direction as more is learned about how to treat long COVID, and ideally as employers start becoming more flexible and providing accommodations. So I spent months following one patient, and I'll just take you through her experience. This is Samantha Lewis. She's in her mid-30s. She lives in Aurora, Illinois, and she works as a director with an agency operating group homes and programs for adults with developmental disabilities. Again, another very demanding job. She's also raising a child with autism and ADHD. And before she got COVID in October 2020, she was an avid roller skater with the roller derby nickname Savage Siren. She had a relatively mild, modest initial infection. She tried returning to work a couple weeks later, but she lasted only 2 hours. Soon, she had to nap by noon every day, and she was so dizzy that things spun when she stood or she walked. Once, she fainted while putting away the groceries, and she hit her head on the microwave and the kitchen counter. So for a time, this roller derby skater, she had to use a walker. And then when I met her, she was using a cane. This was about a year after. That's her using a cane while going shopping with her daughter. Her brain fog and slow reaction time were so serious that about 8 months after her infection, she went to see some neurologists, and she scored 25 on a 30-point neurological assessment, which placed her in the pre-dementia category of mild cognitive impairment at, I think, age 34. She had to sharply reduce her hours in her job, and she sometimes made mistakes like assigning 3 of her employees the same task. Her employer was understanding, allowed her flexible hours, partly at home, and afforded her time for therapy. But eventually she could no longer afford to work part-time and she returned to a full-time schedule. So Samantha got help by participating in a cognitive rehab program, which is a kind of intensive therapy that was originally devised and still used to help people recover from strokes and concussions. She worked several days a week with an occupational therapist, a physical therapist, a speech language pathologist, and they gave her exercises to strengthen her memory, concentration, balance, and endurance. She practiced the memory and attention exercises she learned at home. You can see one of them that involves playing cards, just trying to remember where she's placing things and putting things in a certain order. And the therapist suggested strategies, and one that really struck me because it shows just how much she was struggling. When I visited her about a year after her infection, you can see in this next slide, I noticed in her bathroom, posted above her bathroom sink, was this neon pink index card. And it has 9 steps reminding her how to brush and floss her teeth. Number 4, wet brush. Number 5, toothpaste. And I just thought that was incredibly striking, both for showing how impaired she was and also showing the kind of strategy that she needed. And she also was invited to speak at this conference with me last year. So there's a little bit of video of her talking about the use of this card and that she was still using it. This is now almost, I guess, about 18 months or so after her infection.
They had to get my attention. And I remember telling my husband, I don't think you know what it's like, and I hope you never have to know what it's like to grab your toothbrush and stand there and go, toothbrush, toothbrush, what's next? Did I already put toothpaste on it? Shit, I don't remember. What did I do? Or I would stand in the shower and then I would just suddenly start crying because I couldn't remember if I washed my hair or not yet. I just got in here. How do I not remember what happened? And so we had to do those things. Like we bought these, neon dry erase markers because you can rinse that off on the shower door. And we had those like plexiglass shower doors. And for a long time, we'd just keep writing it down. Once a week, we wrote out on the shower routine. I can shower now without that. I still leave the toothbrush one because there's more steps to that are really important if I'm not gonna lose my teeth, but there's still ones at my office door. Do you have all your crap before you leave here?
And after several months of therapy, Samantha scored in the normal range on the neurological test. Then she graduated from the physical therapy, but she still needs to use these strategies. And this is just a little bit of her talking about how she still needs to use these strategies.
Continue to need accommodations. I continue to work with accommodations, and I think that there are a lot of accommodations and strategies that I've learned and adapted that will likely need to stay with me for the rest of my life. That's the unfortunate thing is that I don't see some of these things, ending. We're at 18 months, and my body continues to do what it will each day.
So I will let Samantha have the last word, but that is the kind of thing I've heard from many, many people. They wanted to return to work. They have returned to work. They are really only able to do it by adopting these kinds of reminders and lists and prioritizing certain activities over others and getting accommodations. And for some people, this may end up being the situation for the foreseeable future. Thank you very much.
Well, thank you very much. That was just an excellent presentation and a reminder of how devastating long COVID can be, not only for individuals, but for the workforce and the struggles that many people have. And also the fact you don't have to be severely sick to get long COVID. You don't have to have the pulmonary manifestations to have the CNS or the cardiac or the diabetic manifestations. Long COVID can affect every organ system in the body.